The following program is sponsored by Southwest Pain Group and features medical questions from viewers. Nothing within the program establishes doctor-patient confidentiality.
Hi, and welcome to Ask the Doctor. I'm your host, Mike Berger. Here to answer your medical questions today are Dr. Robert Bolger and Dr. Renaud Rodrigue from the Southwest Pain Group. Southwest's mission is to care for patients who suffer from chronic and acute pain. The Southwest Pain Group is actively involved in the care of patients who suffer with pain issues. If you would like some questions answered, just call the number on your screen. It's 1-888-572-4411, or go to the website, www.southwestpaingroup.com/askthedoctor. Let's get started with a question. Dr. Renaud, how long has the Southwest Pain Group been in business? And maybe the most important question of all, what the heck is pain?
Well, we've been around a good long time. Dr. Bolger started the group over 20 years ago, and I came on board about 16 years ago. And Mike, to answer your question, it's a great question. Pain is a very unmeasurable phenomenon. It's like an emotion. Pain is a subjective thing. You can't really quantitate it, you can't prove it, you can't show it, you can't demonstrate it to anyone around you. You can look totally normal and have a horrible pain. So that's kind of the conundrum. Patients suffer. Family members see them, you look pretty good to me. I don't really see anything wrong. You say you have pain. I see no manifestations of that because there aren't any. Chronic pain is unmeasurable.
And you talked now we're talking about chronic pain, but there's also acute pain. So between the two, I would assume there could be a great cost.
Absolutely. The cost of pain to this country is easily in the billions of dollars. Tens of thousands of patients are hospitalized each year with pain or go to their doctor because of a pain complaint. And then there's a loss of work, productivity, interaction with your family, prolonged hospital stays because of untreated pain, ER visits. So it's in a time like this when things are soaring out of control as it is in the economy, this is just one more thing that needs to be addressed because of cost issues.
Very good. The phone lines are open, so let's get started. John from Plano is with us. John, what's your question?
I had lower back surgery 3 years ago and there's still pain. Can anything be done about it?
Dr. Bolger?
Well, John, actually, yes, there is many things that can be done about it. And the first thing that has to happen is we need to know why you still hurt. Because there's always a reason. There's always a reason. And one of the things we do in our specialty is we use diagnostic procedures and specialized kinds of treatments to actually locate the pain. It's called pain mapping. So we would probably have John come to our office, examine him, and start a mapping program to try to diagnose why he still hurts.
Now, most of your patients are outpatients, right?
That's correct.
Yeah.
We do see patients in the hospital, though, because we are often called upon to do pain mapping on patients in the hospital as well.
So what kind of, this may sound like a strange question, what kind of doctor are you? We're talking about pain, but are you a anesthesiologist? Are you a surgeon? Where did this all start?
Well, that's a good question. A lot of times patients don't know what a pain doctor is, but in fact, we are anesthesiologists, and actually the specialty was born from anesthesia. Okay.
Now, Gary in Lancaster wants to know, what causes chronic pain?
I'll take that one on. Chronic pain is basically, the definition of chronic pain is pain that persists beyond normal healing time. So it varies on the injury. If you have a broken arm, you expect to hurt for a few weeks to a month or so, you should be better. Pain that persists with a broken arm after a month would be chronic pain. But chronic pain by definition is pain that's been going on for 3 to 6 months or longer. What causes chronic pain could be anything from a nerve injury, a surgery that went awry, or even a surgery that went well, but something happened to some nerves in your body, they were damaged, they're scarred, that leads to people having persistent pain. Okay. There's musculoskeletal entities that cause chronic pain, such as fibromyalgia, and a host of others.
Well, that kind of answers our next question, because Carolyn DeSoto wanted to know if joint pain is considered chronic pain or acute pain, or both.
Really, it can be both. Because you can have flare-ups of acute pain from such as gout, arthritis, but it often can damage the joint and can become a chronic condition.
And we're going to take a slight break. We'll be right back. Don't forget, you can call us at 1-888-572-4411. You're watching Ask the Doctors.